Hello, welcome to the Head on Head News Cabin. I am your host, Head on Head. It is April 2nd, 2020. Going to give you the coronavirus update with over 1 million cases worldwide. We just topped 50,000 deaths, 5,000 deaths in the US. Going to give you the latest on the coronavirus and an article about the uncertainty about the masks, which really has been one of the biggest bumbles, the kind of miscues and just lack of good information onto whether masks are effective. In the way I see it, just through logic and now with data, it's clear that a mask is a way to stop the spread of this coronavirus. The countries who have had masks, as I've showed you in the past few days, are doing much better. And now I'd just like to explain, just from my perspective, it's just really simple. You know, this is spread through your mouth. It's spread through droplets coming out from your mouth onto other people. So if you have a mask on, you're going to be stopping that from happening. It seems very, it seems logical in the fact that, it doesn't make sense to me that if you would do that in a hospital where you're trying to stop the spread, you wouldn't want to do that in other places where it's also spreading. So the mask to me just seems like the logical tool, one of the tools that we have to stop the spread. I'm going to take a look at an article here that talks about the confusion that's been going on. All right, in a U-turn, U.S. Surgeon General asks CDC to see if face masks can prevent coronavirus spread after all. I mean, this thing has been going on for 2 months. I don't understand why it's not obvious that wearing masks in places where we have to come in contact with each other is a definite way to reduce the spread. This is a thing where you're not going to reduce everything. So doing these steps, it seems obviously important. U.S. Surgeon General Jerome Adams had initially advised against the general public wearing face masks. However, Adams told NBC's Today Show on Wednesday that he now asked the Centers for Disease Control and Prevention to investigate whether this recommendation should change. And then, so this is something, so, he's asking the CDC now, but he tweeted on February 29th, seriously, people, stop buying masks. And this is the U.S. Surgeon General. So these are definitely the actions that we will be looking at, well, now, obviously, and just when we're trying to figure out what were the missteps that we took in trying to contain this outbreak. All right, now we're going to look at the numbers. So here we go, the latest 1 million cases, 52,000 deaths. Oh yeah, right here. All right, April 1st, 4,883, up from March 31st. So we're going up. We have not yet flattened the curve. We're going to take a look at the numbers by country here. United States is starting to get hit really hard. 5,800 deaths. Italy, 13,000. Spain, 10,000. And this here, Germany, we really need to figure out how they're able to have such a low mortality rate. I have friends in Germany, and certainly their habits, I think that they're more disciplined in terms of following directions. I mean, it's obviously not something that's such a amazing revelation that Germans do things by the book and they pay attention in their community to be doing the right thing. I've certainly noticed that when I live there, and I think that plays a role. Now the thing is, with the Italian mortality rate, the biggest thing here why they've gotten hit so hard, I think, is because they got hit first. Yes, it also has to do with some other factors, but I think that is the biggest factor, is that Italy was hit first. And then my Italian friend, who responded to a video that I had about the population density potentially playing a factor and the cultural differences with Italy, with people living close together and having a lot of contact, and she was like, that's not it. What it is the face masks, and that they just were completely unprepared. So that's what an Italian person's perspective was on my video. She gave a lot of good information, and it's just definitely better to get the information from the people who are going through it. So again, Italy, you look at that number, 13,915, just a staggering number. All right, then we're going to take a look at the John Hopkins heat map here. So 1 million confirmed cases. I mean, it's everywhere. What is there to look at here? It's red everywhere. We're all hurting. We're all worried about this, and it's definitely affected everyone in some way. All right, guys, thank you for joining me here in the news cabin. I'm also going to put on a mask for you to show you these things can look pretty cool. I got a bunch of these, so if you have them, wear them when you go to the store. Keep your hat on your head and your mask on your face.